Have you ever wondered what your OB is really thinking? What's her perspective on what actually matters during pregnancy and postpartum? Today, we're getting those answers straight from Dr. Caledonia Buckheit, an OBGYN with the Kamm McKenzie Medical Group in Raleigh, North Carolina. And she's a mom of two. She'll share what to expect, what questions you should be asking, and which pregnancy worries you can simply let go of. This is Getting Started with Baby, the podcast that brings you practical tips, loved products, and lived experience from parents who've been there. Brought to you by thestarterset.com, an upcoming service focused on helping parents find just the right things at the right time, personalized to them. I'm your host, Jane Deshevsky, a mom on the other side of 2 under 2. I'm still actively trying to figure all this out, and I'm bringing you perspectives from across the parenting spectrum. Pregnancy and the postpartum period, they're just a time where parents have so many questions. And I know, Dr. Buckheit, you are a mom as well. And so I'm sure you had questions too. And so we're really excited to get your perspective.
Yeah, well, thank you so much for inviting me to be on the podcast. I'm happy to be here.
Well, to get into it, it would be great if you could introduce yourself and tell us a little bit about your background.
Yeah, so I'm Caledonia Buckheit. I'm from Maine originally, and I did my college and medical school in the Northeast. I went to Dartmouth for medical school and then came down to North Carolina to do my OBGYN residency at Duke. And my husband and I really loved it here and decided we wanted to stay and start our careers in the Raleigh area. So I have been with Kamm McKenzie, which is the largest private practice group in Raleigh, for OBGYN care. I've been with them for 3 years now. I have 2 children, 2 daughters. The oldest is turning 6 on Friday, and the youngest is 3.5.
Oh, nice. Happy early birthday to your daughter.
Yeah, thank you.
So, it's interesting when you become pregnant, especially for the first time. Obviously, it's like this whole new experience. And I know for me, I wasn't sure what to expect. And so something that a lot of moms think about too is what should they expect from their OB?
Yeah, so I thought a lot about this leading up to this podcast, what I do day in, day out with OBGYN care, specifically thinking about the obstetric prenatal care. Really, I view my role as basically identifying risk factors and medical problems, making plans for those things to keep mom and baby safe. But then other than that, it's really a surveillance and monitoring role and being a resource. Because for an uncomplicated pregnancy, right, if you're lucky enough to have a very short problem list during your pregnancy, most of your appointments are really just check-ins, right? We're doing a weight, we're doing a blood pressure, we're measuring belly, making sure baby is measuring on track, we're listening to baby, and then really just responding to and answering questions about what's going on in particular for that patient.
Well, I think for a lot of moms, especially with your first pregnancy, you're just so excited to get to see the baby move or hear the heartbeat. But it's interesting to hear it from the other side and the other perspective.
Yeah, I wonder if all OBs would agree with that take, but that's the way I view my role, kind of that new OB visit when you're first establishing care. You really want to get a sense of who is this person who's pregnant, what do they have going on, and what specific things are we going to have to do for their plan, because everyone's plan really is different based on whatever risk factors, unless you really have no risk factors at all, right? And then it's just sort of the standard prenatal care that everyone gets.
And that's a great place to be.
Yes,
if that's the case.
Place to be. Yeah.
You mentioned that there's some questions that parents will come in with at times. What are some of the common questions that you get?
I mean, I think there are a lot of questions. I think early pregnancy, there's a lot of anxiety, and we field a lot of questions about, should I be getting blood work done to monitor, confirm my pregnancy? How many ultrasounds should I be getting? How frequently? I'm thinking about kind of that before 10 weeks, right? There's just a lot of anxiety and angst that comes during that time. And I think understandably so, because that's really the time frame where we unfortunately see 1 in 4 pregnancies are going to end in a miscarriage. And almost always it's not because of anything you did or you didn't do, which I think is just hard for people. I think they're like, what can I be doing to prevent a miscarriage? And I'm like, literally nothing. Assuming you're not smoking and doing drugs and things like that, you're living a normal, healthy life, there's unfortunately not much that you can do to alter the course of a pregnancy. So field a lot of questions and kind of manage a lot of anxiety in that early pregnancy stage and just provide reassurance that time will tell and we just have to watch and wait. Once you clear that 10 to 14 week hurdle and you're getting into the second trimester, then miscarriage, pregnancy loss becomes much, much less common. And so you can provide that reassurance and usually people have their anxiety starts to shift to different things. And so I think the next questions are often about, should I be monitoring my baby with a Doppler at home? When should I expect fetal movement and what is that movement going to be like and things like that. So really, I joke when I was pregnant as an OBGYN, I was a resident when I was pregnant with my first and my second actually, but being a resident and like knowing all the many horrible things that can happen with pregnancies, then luckily usually don't happen, but what I was worried about and what I was scared about just changed throughout the pregnancy, but there was always something.
And by the way, I didn't get a Doppler, but I definitely got a stethoscope so we could try to listen to the baby. And I don't think it was very effective.
Yeah.
There was something you said about how in the early days, people have so much anxiety about what can they do to prevent a miscarriage, for example. And I was actually just listening to a different podcast a couple days ago. They were talking about how much pressure the mom was putting on herself to do everything right in the pregnancy. And if something were to go wrong, how she would blame herself for it. And that seems like a really common thing. Do you have any advice for moms facing all that anxiety? Like, how should they be thinking about it to lessen that a little bit?
The vast majority of miscarriages when they occur is not because of some external factor. It's usually because either the sperm or the egg had an abnormal genetic complement, or when they got together and started replicating, there was an error and therefore it couldn't continue developing. We have no control over that, right? So I think just understanding that that's the cause of greater than 90% of early miscarriages is genetic factors that there's literally nothing you can do about. I think just you have to watch and wait and understand that outside of just staying hydrated, getting sleep, avoiding toxic exposures, other than that's really all you can do. And if you're doing that and you have a miscarriage, you didn't do anything wrong,
Hopefully that can give people some relief because it's a lot to take on. It's super interesting that you have this background as an OB and you have all the knowledge behind the curtain, but also have experienced pregnancy and motherhood yourself. I guess talk to me a little bit about what that was like and what kind of questions you had knowing some of the information that you already knew.
So, I think with my first pregnancy, I was very lucky to have like a very low risk, uncomplicated pregnancy. I tolerated pregnancy pretty well. I wasn't super sick. I was able to stay active and work, and I didn't develop any major complications. And so I think that was good to experience a healthy, normal pregnancy because I feel like I have a good baseline just from my career, of course, but also personally, that I understand what a normal, healthy pregnancy entails. And so when I'm talking to patients and they're telling me about what they're experiencing, I'm able to use that as a reference point that I think is very helpful. I also, in my second pregnancy, I developed a very severe complication, ended up delivering at 27 weeks. And experiencing the NICU, and I myself was in the ICU. And so I know also what a very complicated pregnancy can feel like too. So I think it definitely, my experiences as somebody having babies and being a mom has made me a better doctor for sure. I also think though, I'm careful to not expect my patients to have the same experience that I had, because it really is, there's a lot of variety of how different bodies and different people experience and tolerate pregnancy.
And that must have been really scary with the second one.
Yeah. And what that really taught me is that, and I know this as a physician, that complications can happen to anyone, but it just really illustrated that because like I told you, my first pregnancy was so low risk and uncomplicated and boring. I really did have the expectation because you're always taught history is a very good predictor. Usually similar things will happen in a future pregnancy, right? And so I think I was really caught off guard by having such a severe complication when I had no warning signs or lead up to that to give me a heads up that that would potentially be the case.
Are there warning signs that people should look for? I mean, it sounds like in that case, there wasn't something, but is there something that parents should look for?
So a couple of things, we talk a lot about risk in obstetrics, and I see a huge part of my role as just mitigating risk, because most of the time bad outcomes are not going to happen, and we're really just doing all of these interventions and monitoring to prevent a bad outcome, essentially. And so in some people, I'll give kind of hypertensive disorders of pregnancy a spotlight here, because they're unfortunately pretty common, affecting like 5 to 10% of pregnancies. And so there are very clear risk factors for developing hypertensive disorders of pregnancy. And that's something we review at the beginning of your pregnancy. We put people on aspirin to prevent preeclampsia. There are things that we can do to monitor and mitigate risk around hypertensive disorders, and also educating that patient who has advanced maternal age, an IVF pregnancy, a history of gestational hypertension and a prior pregnancy. For that patient, she has had that education that this is something we're looking out for. These are the warning signs we're going to be looking for, your blood pressure, your symptoms at every single appointment. And that patient is kind of on guard and thinking they understand that their risk for that is quite elevated. I think it's harder. For what happened to me was I developed an infection with listeria. So something like that, I didn't really have any risk factor for that other than the fact that I was pregnant and my immune system was different because of that. That's a little harder to predict because there was no education or changes you can make to a prenatal plan to reduce the risk other than just your standard advice around food safety that we give everyone at the beginning of pregnancy. And outside of that, there's unfortunately not really anything you can do.
I remember the listeria warnings as well, and there were certain foods that you were told definitely to avoid. Can you share what some of those common ones are?
Yeah, so the common ones that we talk about are cold cuts, like deli meats, soft cheeses, raw fish, raw meat, right? But the reality is that listeria lives in the cold and can literally be on almost any food product. We're talking dressings, yogurts, frozen waffles, ice cream, anything. And so that, I think, is frustrating and hard. So instead of telling people this list of arbitrary foods, I basically try to educate around understanding how listeria lives and dies and understanding how your food is processed before it gets to your plate. Because if you understand that, then you can make educated choices about your foods, right? And so, for example, buying the whole cantaloupe, washing it yourself and cutting it up yourself, right? You're going to limit multiple steps of potential contamination, for example.
It's actually really good advice because you're told to be careful around so many things. And I think a lot of times it's sort of passed down and you don't have all the information about why or what can you do to reduce the risk.
Yeah, I think thinking about the big picture and taking those general steps makes more sense and is, I think, easier for people to implement. So I talk more about washing, prepping, and preparing more of your food at home as opposed to eating out, avoiding things like big communal food sharing, things like, the buffet or the salad bar, things like that, where there's more potential for contamination.
Absolutely. Are there questions that you think every mom should really be asking in their appointments or should focus on that many moms either don't know to bring up or are nervous to bring up?
So I think one thing that's a good topic to just talk about in the third trimester is fetal movement expectations. I think just from a stillbirth prevention standpoint, every OB practice that I've ever heard of, every obstetrician has some standard education we give around fetal movement and kick counts in the third trimester, right? But every pregnancy is a little bit different in terms of how people feel movement. Every baby's a little bit different. And I think that's something, at that 28, 30, 32 week, those appointments in the early third trimester, talking with your provider about what's normal for you and is that reasonable to monitor in the way that you've been monitoring, et cetera, thinking about different tools. I mean, there's apps you can use now. That's a good topic to touch base with your provider about.
If there is something that a mom is noticing that seems different about the fetal movement, How should she bring that up?
Yeah, I think one point that I want to make about fetal movement is there's not really any such thing as too much fetal movement. I will get that question where people are like, my baby's moving in a certain way or more frequently or more forceful, or I think they're moving too much. No. If they're moving, we're happy with that. And it can be a lot, it can be strong, it can be frequent. That is good. There's no such thing as too much fetal movement. But it's really decreased fetal movement that we're thinking about. So a significant decrease from your baseline normal fetal movement, you should call your provider. And then the floor sort of for all comers, if you want to say like, okay, literally every pregnancy should be able to get 7 to 10 noticeable movements in 2 hours after about 32 weeks. Okay, that's the floor, the very bottom. Every single person, whether they have an anterior placenta, whether they have, a smaller baby, really after 32 weeks, that's kind of the floor. Everyone should be able to get that. But again, my babies were so active, I never counted kicks, right? Because if I did, I would get 7 to 10 movements in 5 minutes. So, for me, if my baby had then started moving only 7 to 10 movements in 2 hours, for me, I would have called my provider. That's not normal for me, for my baby.
That's super helpful to understand with pregnancy and then the postpartum period, especially the first time. There's just an endless string of things you can have anxiety about or be paranoid about.
Yes.
Are there ones that are common, but that you feel like, we talked a little bit about putting a lot of pressure on yourself about miscarriage, but are there other ones that you hear a lot about, but parents should let go?
People have a lot of anxiety about the start of labor and their water breaking and just going into labor. And so I do a lot of education and discussion around the fact that these things declare themselves, right? So if you are in labor, the contractions will become more painful, more frequent, more intense, and they won't go away. All right. So you don't need to stress and worry and keep yourself up all night because you've had a couple of contractions. Do you know does that make sense?
Yeah.
Such a common sense of anxiety. I don't know why. Are we afraid we're going to miss it?
The real fear was that I was going to have this baby at home and not make it to a hospital.
Yeah.
I don't know what people's fear are.
Yeah, that's a common anxiety too. And among first-time moms, I try to reassure them that I'm like, hey, in about 90+% of first-time moms, labor is going to start in this slow, prodromal, progressive, eventually getting intense sort of way. So you will have plenty of time to get to the hospital. There is, of course, that very tiny subset of first-time moms that really do have super, super fast labor. But I've only seen that a couple times in the, 7 years that I've been an OBGYN. So
yeah.
I think you can rest assured just statistically that's unlikely to happen with that first pregnancy. I think in patients who have a history of precipitous labor, say their second baby came super, super fast, their third baby's probably going to come faster, right? And so that is, history is a good predictor. And so I think, that is reasonable to be planning and kind of thinking early about that. The other one is about did my water break, right? Because it can be a big gush like the movies, or it can be more like a slow trickle or like little gushes here and there, right? But however it happens, it will declare it. Because again, labor and your water breaking aren't really emergencies. I think the movies make us think it's an emergency, but it is not. Like this is natural, normal, and it'll declare itself and it will progress over time. And
I think it's just hard too, because your experience with pregnancy and labor and water breaking, you have such a small sample size as a mom personally. So there's all these, how will I know? What if it's like this? What should I do? I'm sure that those late night nurses are getting a lot of phone calls. They definitely did for me during that time.
Yeah, I think the phrase I use all the time is it will declare itself.
That's such a good one to live by, especially because there's so many things that people can live in the future about. And what if this happens? And what if that happens? And so it's helpful to have the quick phrase to be like, it's going to be okay. What about the postpartum experience? I think one thing that I've heard sometimes, and I feel like I've experienced as well, is still feels like when that prepartum, you're getting so much attention and you come in so often and somebody's checking on the baby, and then postpartum, it can feel like a really different experience. Does that resonate with you? What would you tell moms to expect of that period and how to advocate for themselves?
Yeah, so I think about the postpartum period, whether you have a vaginal delivery or a C-section, I kind of think of it like a surgical recovery, right? And in a surgical recovery of any kind or recovery from a delivery, you should feel a little bit better every single day, right? You should feel a little bit more back to yourself every single day. And so say you had an uncomplicated vaginal delivery with a second-degree laceration, right? Very common situation. That second-degree laceration for the first, 2, 4, 6 days is pretty sore, but it's feeling a little bit better each and every day. So if you're a week or two out and all of a sudden you're like, oh my gosh, I'm having all this pain and discharge and whatever, like, that's not normal. It really should be marching ahead, feeling a little bit better every single day. And so when that's not the case and something new or concerning arises, or a symptom that had been improving is all of a sudden getting worse, that's the advice I give my patients, whether they had surgery or whether they had a delivery. That's when they should call. I think one thing that's tricky with postpartum, we get a lot of questions about, is postpartum bleeding profile, because it can be so varied. It's so different person to person. And so it's hard to give advice. It's hard to give return precautions even, and you'll get different precautions from different people.
One question we had from a listener was, in that prepartum period in utero with the baby, are there things you should be doing? Should you be communicating?
I mean, I think that in utero, or we know that babies are taking in their environment before they are delivered, right? So during pregnancy, the baby is developing hearing and a sense of light and figuring out how to move and grow in their environment. And they are appreciating the sounds and activities that are happening around them. I think, though, this is one of many things in pregnancy that you can choose to stress yourself out about if you want, but I wouldn't worry about it for most people, right? Because just by living your life, by talking to people in your day-to-day life, by listening to those people around you, by listening to music in your car, you are helping with the growth and development of the baby. I think if it helps you and your partner bond with the baby and feel connected and wanting to share things specifically with the baby, like certain books or stories or types of music, by all means, it is, I'm sure, beneficial. But I think you can rest assured that the day-to-day living in your body with your baby in utero is going to provide benefit and help with their growth and development.
Got it. So it's you can do it, but you don't have to do it.
What I notice among my patients is it's almost like, and I don't know, with social media, with books, with people, it's like this endless list that develops for my patients where they feel like I have to be doing X and Y and Z and I can't be doing, A and B and Z. And so I think, don't let that be something that's stressing you out, that's adding to your to-do list. Because I think at the end of the day, the focus should be on just having a healthy and happy life during your pregnancy to the best of your ability.
Yeah, and post your pregnancy, hopefully.
For sure.
Yeah, it's an interesting thing about modern parenting because, of course, there's always been advice and people's opinions, but it's just so amplified.
Right. The quantity of information, just the amount it seems very overwhelming.
Well, one of the things that we do with this podcast, we really try to focus on what are some of the things that people actually need or that are actually helpful to real parents or that doctors recommend, in part because you're so inundated with advice, opinions, and stuff and marketing messages. In that spirit, is there anything that you think, product or service, either really helped you or that you generally recommend?
So when I thought about this ahead of the podcast, what came to mind for me, because with both of my children, I breastfed both of them. One of them breastfed and I pumped breast milk for my first child. For my second, she was never able to directly breastfeed, but I produced breast milk and pumped for a long time for her. And so thinking about if breastfeeding or producing breast milk is part of your plan, a couple of points of advice that I would want to give. One is you should invest in a double electric hospital grade breast pump, because there are a lot of breast pump options, but usually your insurance will cover a breast pump, and it should be almost totally covered to get a double electric hospital grade breast pump, like a Spectra S1 or S2, or like the Medela Pump and Style, for example. Those are great products. You need that. If you want to do Cozy Willow, LV, one of these hands-free options in addition, I think that's reasonable depending on your life situation. You're going to need that tried and true, really good, strong breast pump if you plan on producing breast milk, even if you plan on directly feeding almost entirely. I think I still would recommend having that, because you may need it at certain times, like if your baby's sick or if you are traveling. I think having that and insurance covers it, I highly recommend that. And that's usually something I recommend people get kind of in the mid-trimester time. So maybe 24 weeks or so, looking at that and going ahead and ordering that. The other thing is a good pumping bra. The one that I recommend is the Kindred Bravely pumping / nursing bra, the Sublime bra. I exclusively wore those bras for, over 2 years of my life between my 2 kids, because it's such a good product. I tried multiple different types of nursing and pumping bras, and I did not find anything that was better than that. I sometimes will hear weeks into pumping that women are just holding a pump on them. So we have let you down as a society if you don't know that you need a pumping bra. So,
I don't think I knew that pumping bras existed until I started the process either. So it's good to hear somebody voice that.
Not around it, you might not know until you're in it and you're like, wait, what? What do I do?
Yeah, I feel like that is a lot of parenting stuff. What about things that people maybe get that they maybe shouldn't have gotten?
This, I don't know. I feel like I didn't buy a ton of baby stuff. I think, when babies are little, they don't need a ton of clothes. It's pretty simple to swaddle. They don't really need socks or headbands or anything like that. Just pretty simple is really all you'll need. There's a lot of skin to skin and just a swaddle that the baby's going to do. It's nice to build a community around other people who have kids and love those relationships and friendships. But I think one thing that's really nice is just that passing of knowledge and also stuff. Because once you're done having, I cannot wait to now my kids are 3.5 and 6. As soon as they are done playing with something or using something, I cannot wait to give it to somebody I know who has a child that's younger than mine. So I think, having those hand-me-down trains for a little, baby toys or developmental stuff that they use, there's black and white mats. So somebody has that and they don't want it anymore. So talk with your friends and use your community for that kind of stuff, and don't stress about it or spend a lot of money on that kind of stuff.
Totally. I still have stuff. I'm looking around this room and I still have stuff. And I'm like, my children, the youngest one is almost 3. So if I see a pregnant woman, I'm like, do you need stuff? If there was something you would want moms to take away from this conversation, what would it be?
I think just trust the process, try your very best not to sweat the little things, and big picture, statistically, most people do quite well during their pregnancies, and most moms and babies do quite well. So I think stepping back and seeing that big picture when you feel like you're really stressed and anxious about every little thing can be helpful. And I hope this podcast has helped people feel that way.
Yeah, absolutely. Well, thank you so much. Again, this conversation has been super informative. We're really excited to be able to talk with you today, and really appreciate you taking the time. To hear more from Dr. Buckheit, you can follow her at either Instagram or TikTok at CalibMD. Check out the episode notes for the Instagram and TikTok handle. And thank you again for listening.